Okay, let's dive right in. The operating room, it's this place of incredible human skill, intense pressure, and absolute precision. Well, it's about to get a new assistant. This one doesn't wear scrubs, but it's powered by artificial intelligence, and honestly, it's probably going to change everything.
But to really get why this is all happening right now, we've got to look back. We need to understand how we've been training surgeons for, well, centuries.
For generations, it's been all about this mantra: see one, do one, teach one. It's a classic apprenticeship, right? But that means everything, literally everything, depends on how good your mentor is and, frankly, how lucky you get with the cases that walk through the door.
So you can see the problems, right? The training can be all over the place. Seeing a really rare but super critical procedure, that's just luck of the draw. And let's be honest, there's always a risk to patient safety during that learning curve. But what if? What if there was a better, safer, and way more consistent way to build a surgeon's skill?
And that's exactly where AI comes in. Not as a replacement for human teachers, no way. Think of it as this incredibly powerful new tool in the toolbox. And it all starts with how we train the next generation.
Seriously, think of it like a flight simulator, but for surgeons. These AI-powered simulations let trainees practice the most difficult, most complex procedures again and again and again, all in a completely risk-free virtual world.
And we're not just talking about some glorified video game here. These AI systems can track a surgeon's every single move. They analyze technique, precision, decision-making, all of it against thousands of data points. And the best part? They give instant, totally unbiased feedback. They can even customize the training to focus on someone's specific weaknesses. It's a way to bring world-class surgical training to anyone, anywhere.
But training, that's just the beginning. Where AI gets really powerful, almost spooky, is its ability to crunch massive amounts of data to see what's coming next, to predict the future before it even happens. So, how good is it? Well, get this. Some machine learning models have shown up to 96% accuracy in predicting surgical site infections. Just imagine that for a second. Being able to step in before a patient even has symptoms, that's an absolute game changer for keeping patients safe.
And this isn't some pie-in-the-sky lab experiment. It's already happening. Hospitals like Tampa General are using AI right now to make their operating rooms more efficient by predicting exactly how long each surgery will take. What's the result? Fewer delays, better use of resources, and more patients getting the care they need faster.
Okay, so let's follow the technology right into the operating room itself. This is where we see the next big leap: AI-assisted robotic surgery, where that intelligence is built right into the machines.
So you've got this fascinating race happening. You have the big name Da Vinci focusing on analytics after the surgery. Then you've got challengers like Medtronic's Hugo and CMR's Versius using the cloud and machine learning to help with training. But there's one system that's playing a totally different game.
Now, this is the part I find absolutely fascinating. It's this idea of augmented intelligence. The Senhance system isn't trying to take over. Instead, it's designed to supercharge the surgeon's own senses. It uses things like eye tracking to control the camera and gives real-time guidance during the operation. It's basically a digital co-pilot in the OR.
But, whenever you have this kind of incredible power, you inevitably run into some really interesting and really tough ethical questions. And we're all just starting to figure out the answers.
So, AI systems learn from the data we feed them. That's how they work. But what happens if that data already reflects the historical problems and imbalances that we know exist in healthcare?
I mean, it raises this huge question, right? If an AI mostly learns from data from one specific group of people, how is it going to perform for everybody else? The big danger here is that you could accidentally bake old biases right into our most cutting-edge technology, making healthcare less fair, not more. And the bias problem is just the tip of the iceberg. You've got other massive questions, like how do we keep all this patient data secure? And should you even be told if AI is involved in your surgery? Then there's what's called the black box problem. This is when an AI gives you an answer, a recommendation, but you have no idea how it got there. If we can't see the logic, can we really, truly trust it?
And this whole chain of events perfectly sets up the ultimate dilemma, which just gets more and more complicated as these robots get smarter and more autonomous. And listen, this isn't some far-off science fiction movie. A robot named Star has already performed autonomous surgery all on its own with incredible results. So this brings us to the billion-dollar question. When a machine makes its own decision and something goes wrong, who's on the hook? The surgeon who was supervising? The hospital that bought the machine? The people who wrote the code? It's a massive legal and ethical puzzle that we are all racing to solve.
So you see, it all comes down to this. Putting AI in the operating room isn't just a technical challenge, it's a deeply human one. We're trying to balance the unbelievable precision of a machine with those things that are, uniquely human: empathy, gut feelings, and making those impossible ethical calls.
We have to find that perfect balance. We need to design systems where the technology serves the medicine, not the other way around. The real goal here is to augment the surgeon's amazing skill, to free them up to focus on the most human parts of their job. We have to make sure that deep human connection at the very heart of healing stays right where it belongs. That is the true challenge ahead of us.